The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle, and we've got a great program for you. As always, we're going to try to give you information that you can use. Have you ever wondered if you're losing your mind, if you're starting to slip a little bit, if you're starting to say, oh my God, I don't want to go down that road to Alzheimer's? Well, there are signs and symptoms that you need to be aware of, and I want to cover those with you today. And by the way, those of you in the Washington metropolitan area, this leads into an in-house program that we're going to be doing on the 17th. It's a Wednesday evening at 6 p.m. at the Roselle Center. Dr. Scott Lamp and I will be going tandem, if you will, and we're going to walk you through this. We're going to cover things that you need to know about, but more importantly, what you can do about it. And there's some things that you can take action steps on now, and we're going to get into that a little bit today. And I want you to be aware of what you can do to make a difference in your own life. Ready? So let's pull this apart a little bit, because there's so much misinformation out there about I'm losing my mind, if you will. So let's talk about that just a bit. And if you look things up, you go to the Alzheimer's Association, you go to any of the psychological websites, there's a list, there's a host of things. But let's talk about the common warning signs and symptoms that you may not be aware of. Memory loss is one that shows up because of a lot of different things. It can become because of trauma, as we've talked about over the last several weeks. It can come about as a result of stress patterns, PTSD. We talked about that last week. But memory loss, common early sign, if you will, it really is, of frequently, now here's the thing, frequently forgetting recently learned information. And these have to do with dates and events and people that you may have met and so forth. If you're like me, years ago, I used to laugh all the time. I'm like the bartender. I met you, I know all about you, but sometimes I forgot your name. But it's like the bartender who knows the person, knows the drink, knows what they need to hear, but forgot their name. And then over a period of time, more interactions, it gets ingrained. But that's not what we're talking about. We're talking about something that you should know that normally is tantamount to anything else. And all of a sudden it's not there anymore, but it's happening not just occasionally, it's happening on an ongoing basis, a regular basis. So how does that move forward? Well, if you can't remember things, you can't problem solve. And problem solving, planning, that type of thing, difficulty in putting a step-by-step situation together. It's like a young kid. A child early on should be able to handle a couple different tasks. Go do this, Jimmy, and come back with this and put it over there. That should be an easy thing at a certain age. But what happens is sometimes we see ourselves reverting back to that small child, and we can't link multiple pieces. We can't repeat numbers. I had a patient the other day, and I knew that there was some brewing problems with memory, and his wife was giving me a heads up. She said, I don't know if this is the case, but can you check it out? And I said, sure. So I said, hey, man, I said, listen, I want you to repeat a couple things for me. So I said, ABZ 101568. And he got ABZ 156 maybe, and he couldn't remember the last one. So I gave him multiple pieces like that, and he clearly could not serial link 8 or 9 or 10 different combinations of things. So we ran a test, and he's showing some subtle changes, and there's a lot of different imaging. We'll talk about that as well. So how about this? Difficulty completing things that you should be able to do. And what that's about is the struggle to complete daily tasks, if you will, either at home or at work, or even going out and just relaxing a little bit, driving to familiar places, organizing the things that you have to do, a punch list, something as simple as a grocery list. If that's the case, better stop and think a little bit. And it's time to get somebody to help you make a decision. Am I going down this bad place And what do I need to do about it? Well, on the 17th, if you're in the Washington metropolitan area, we're going to show you what you can do about it. And by the way, to register for that class, it's real simple. Go to drtomroselle.com and let us know that you're coming so we can prepare for you. And by the way, as always, if you do decide you're going to come and you can't make it, just send us a note, because we always have a full house and we want to make sure that we have enough room and preparation for everybody that's going to come. So when you're confused, there's a confusion because you're too fatigued, you're tired, you don't stop, and you haven't gotten enough sleep. You're confused sometimes because you haven't eaten well, and ongoing putting inflammatory reactions in your body. Too much sugar, particularly this time of the year, right? Sugar, yeah, everybody's attracted to it. We're all addicted to it. You've heard me talk about years ago that in the beginning stages of this country, the average consumption of sugar per person on an annual basis in the good old US of A in the colony days and so forth was only about 16 pounds, 17 pounds per year. That sounds like a lot. Do you know what it is today? 170 pounds. I don't know about you, but I don't eat a lot of sugar. So who's getting my share? Now, we wonder why people are walking around a little larger than they should be. That's one of the biggest reasons. But here's the thing. This is the reason I'm bringing it out when it comes to your mental set. If you're eating sugar that your body cannot process, it's going to store it. And it stores it in one of two ways. It stores it as fat, but it also stores it in the form of glycation. What does that mean? Have you ever taken a saucepan and put sugar in it and heat it very, very slowly? It caramelizes, right? It gets real thick. Well, that happens in your body, in your heart, in your brain, in other places. And so we want to avoid that. It's not that all sugar 100% of the time is bad, but we have to create the body's ability to get rid of that storage stuff so you don't continue to plaque it, if you will, in the brain. So when we're looking at that type of situation, maybe that's why the confusion's there, because the neural synapse can't work the way it's supposed to. If you had COVID, we know that the brain isn't communicating the way it's supposed to. And there's study after study after study that's showing increased levels of forgetfulness, increased levels of dementia, increased levels of confusion. And it's because that spike protein can cross the blood-brain barrier. We're going to touch upon that a little bit also on the 17th. But here's the deal. You've heard about the nicotine patches that allow people to kind of reformat their neurological connection. Well, it's really true. And there's studies out there right now that are thousands and thousands of people that have been involved. So you take a little bit of nicotine patch, those patches that you use to quit smoking, they're usually about 21 milligrams. You cut it into thirds and you take one of the little patches and put it on your neck or on your chest or on your back, because you have nicotine receptors everywhere in your body. It's not addictive. You actually need that a little bit. And I'm going to give you another little piece of information in just a second. So here's the deal. You put that little nicotine patch on you, and then within a week's time, you change it every day. You take it off, 7 milligrams. That's it. No more than that. And all of a sudden, you notice that there's some clarity that's going on. If it was a result, if you said, yeah, I was totally cool until I got COVID. I was totally cool until I got that vaccine. This could help you. And they found that people that, were smokers and ate things that were high in nicotine, like what? Like tomatoes and like eggplant and so forth, didn't get as sick as other people did during COVID. They don't seem to have the same viral loads that other people do. But you can't get hurt unless you're very sensitive to nightshades, which is some of the things that we're talking about. But otherwise, just go get a nicotine patch. It's not addictive. It's not, the guys that were smoking cigars and cigarettes, they seem not to have as much of a problem during COVID. God knows why, because we know it irritates the lungs, but the jury's still out on that. And I have my challenges when it comes to that. So confusions are another one. What happens when you get in the car and you know where you're going, and all of a sudden you forgot it. You bypassed an exit. You're on one of the major highways and you know you had a turn, but your head got distracted and you missed that. That's something that you have to look at. How about when you lose track of dates? You're not sure what it is. Sessions that, different meetings and so forth that you're supposed to attend to. Here's one that got me the other day. And I was thinking about a meeting that I was supposed to have. And there's several meetings that are stacked on this one meeting. And then I realized that I had had that meeting a week ago on the same day, at the same time I was going into, and it was like, a Tuesday at 8 o'clock at the night. And I looked at myself and I said, slow down, brother. You got some confusion going on. And for me, it was fatigue. I was just been pushing too hard, wasn't getting a lot of sleep. So I forced myself for a couple nights in a row to reformat. And I sat there. At least I remembered it, right? But I remembered it, that I forgot that I had already remembered it and did it. So here's the deal. If you start getting confused on dates and times and places and so forth, that's a big signal, but only if it happens on a regular basis. Happens to all of us occasionally, but only if it happens on a regular basis. And all these things are like that. Are you getting confused because, right? Well, trouble understanding also what images mean. That's a big tell. So let's say that you're driving someplace and you forgot what the sign means. And just for a moment, I said, oh, yeah, or the color or the differentiations of things. How about problems with words? You get into a conversation and you insert a word that doesn't mean anything about what it is that you're trying to explain. So where did that come from? That's something as well. You misplace things. How about poor judgment? You changes in your decision-making process. Your frontal lobe isn't working the way it's supposed to. Those types of things can be problematic. And then as it gets progressively worse, you got things like you forget to wash your hands where you're very, very hygienic otherwise. And those things can indicate a dementia pattern. It's a habit that is something you've done all of your life, and all of a sudden you can't. All of a sudden you don't want to be around people anymore. You withdraw. You start avoiding social engagements with people. You drop off hobbies that are involved with other people. Work projects that you really enjoyed working with a group in your office and so forth, now you avoid. Those pieces of the puzzle are not okay. So here's the deal, and I want you to know this, and I'm the guy that's going to go conservative on everything all the time. If you or someone you love are experiencing any of those things that we just talked about, but you notice them, it's not just one time, don't get nitpicky. If you see it on an ongoing basis, you got to talk to somebody who looks at it, one, from a natural point of view. Trust me, the drugs out there can make things much worse. And sometimes, by the way, the drugs that you take, and if you look them up like on drugs.com and you stack them, many of the symptoms that these drugs are about and compounded cause all those things we just talked about. And you think that you're, oh my God, I'm going into the early stages of Alzheimer's. Well, you might be, but it also might be something that's induced because of something else. So what we want to do is we want to make sure that you have all the tools to really understand, if you will, what it is that might be happening to you. I don't want you to get into the place where you suddenly say, what's, I know their name, but oh my God. And it's somebody that you're with all the time. That's straight up. And it's scary. It's phenomenally scary. So what happens when you're at home and you have one of your children, your grandchildren, one of, your spouse, and you look at them and just for a moment, you can't remember their name. There's many of us out there, when we get over fatigued, we get super tired, some thought process and retrieval mechanisms are automatic. They're very, very quick. But how about when you have to sit there, somebody very well? I'll give you an example. Years ago, and this is after a trauma that took place, was a car accident. And I'm a guy that came from a double major undergraduate school, pre-medical sciences and political economics. That's called the ultimate of indecision, by the way, right? But I was going through and talking about different pieces of political positioning. And I couldn't remember a very notable guy that goes back many, many moons ago. When I tell you, you're going to realize how old I am. But Henry Kissinger. And I couldn't remember the man's name. I could describe him. I could tell you what he did. I could tell you the administration that was in, going back to Nixon and so forth. I could tell you all the things that were involved. And what we were talking about is some of the international backdoor, if you will, governmental control agencies. And he had to be at the top of one of them at the time. And so and I said, there's this guy, and I can't remember his name, can't remember his name. And then finally, it dawned on me. I could see his face. I could see him moving. I could remember the things that he did, but I knew what it was. It was from a trauma that I had where I'd smacked my head. I was in Las Vegas coming off an escalator, of all places, at the Flamingo Hotel. And I was with my staff, and I was standing backwards talking to one of them. I got down to the end of the escalator. There's a pretty good lip on it. And both of my heels hit, and it threw me backwards. So instinctively, I turned to just let myself glide and put my hands out. But what stopped me was my head in a marble pillar. And it wasn't cool, right? So from that point on, we laughed about it. I went to the hospital. I didn't fracture anything, but I knew that I had a concussive pattern. And it was shortly after that when I was starting to get things like that. So we have the tools. And so I started really applying the tools, and I got it back. But as we get older, often we begin to realize that we're slipping a little bit. And that slipping a little bit has to do with many different things that have compounded over a period of years. Has to do with eating the wrong things, the sugar that we consume over the top. We don't get any exercise. We are constantly being exposed to all kinds of electromagnetic fluxes. If you're living anywhere near the Northern Virginia area, you know that you're constantly being exposed to data centers. They have an ongoing electromagnetic flux that's significant. The truth will come out. I've been kind of raising that banner flag now for quite some time, and it will affect you in a lot of different ways. So if we know these things are true, how do we protect ourselves? What do we do to find out if our biochemistry is not working? We have things called neurotransmitters. The majority of them are produced in your intestinal tract. There's an easy test that you can do with saliva and urine to find out and we're talking about dozens of these things. There's testing that you can find out if you're beginning to slip in different areas, meaning your inflammatory levels are way too high. And then specifically what you can do is called brain span. And on the 17th, we're going to talk to you, if you're in the Washington metropolitan area, we're going to talk to you about those tests and how to interpret them. But more importantly, how we can perhaps even work with you to make a difference, but holding your hand and getting your doctor even to do them for you. So join us on December the 17th. So Wednesday evening, 6 p.m. at the Roselle Center for Healing in Northern Virginia. We're in Fairfax. Easy to find us. And by the way, if you want to talk to one of our doctors ahead of time, it's our gift to you. All you do is go to the top, say, hey, I'd like to have a short consultation with one of your doctors. We've got brilliant guys that work here, right? So reach out. And if you'd like to do that, even if you're out of the area, please make it done. It's a free 20-minute consultation, but we can make it happen for you at the Roselle Center. And because it's our gift to you. That's what we do. We're here for that. Anyway, let's wrap this piece of the segment up just a little bit before we come to the second part, and which, by the way, you can find in many different areas. If you have something to do right now, go to drtomroselle.com, and it's there for you. So let's get into a wrap up on this, just a little bit what we talked about. So if you're losing your thought process, you can't continue cognitate the way you're supposed to, meaning from one piece to the next, 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 right? That's a sign. If you're having trouble following directions, that's a sign. If you don't recognize signs, that's also an indicator. If you're getting confused, you can't follow directions like you used to. If you're not succinct, if you're avoiding people, you don't want to get involved anymore, you're afraid that you're going to be embarrassed, those may be indicators that you're having a problem. So if that's the case, you got to do something about it. Don't let it build, because in today's world, there's a lot of things that you can do to reverse it. We have tools to make a difference, but once you get on the medications like Aricept and so forth, it actually can perpetuate it and make it worse. We're coming up to the break, and we're going to come back with a whole lot more data and information. We're going to tie this together even more for you. But remember, all the data that we present to you is also available on drtomroselle.com. It's our gift to you. It's ongoing. My job is to inform you, to make sure you have the tools. We'll be right back. Don't go away. Got much more for you. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop Ageless Health Store